units of units that you have to know in radiology. One such unit is the Hounsfield unit. Depending on the value of this Hounsfield unit only, the exposure to that particular tissue will be there. For example, the air will have a black in color. This is for CT, okay? CT, X-ray, all those radiations. There will be the black in color and the Hounsfield unit will be -1000. Fat will be -100. Zero for water. Soft tissues, 80. Acute hematoma, it will be 100. Whereas at bone, it will be +1000. These are the Hounsfield units. This +1000 Hounsfield unit is only making this CT picture of a bone into a white platform. Okay. Next, coming to few important theory questions. First you have to know about the units and the SI units. What is the unit of radiation exposure? It is Roentgen. Whereas the standard SI unit will be the coulombs per kg. Right? Absorbed dose will be, whereas in SI unit will be gray. Equivalent dose, it will be REM in case of equivalent dose in normal unit. SI unit will be sievert. These are very, very important things that you have to know. 1 sievert is equal to 100 rem. 1 gray is equal to 100 grams. Okay, these are the small conversions that you have to know. Then, whenever we increase the voltage of the current which is passing through, that will increase the penetration and decrease the contrast. Whenever we increase the amplitude, the amplitude will be in milliampere per second, right? So whenever I increase the amplitude, there will be an increased contrast and no effect on penetration. Right? This is what is regarding the units and the technical aspects. If you coming to the theory as such, X-ray, it was discovered by Roentgen. You know that it's an electromagnetic radiation. It is produced from an electron beam that is from the cathode made of tungsten element, and it strikes on an anode which is also made of tungsten. Right, the emitted rays will be the so-called X-rays. These X-rays, when it after passing through the tissues, it has to go and hit on a photosensitive material. That will get the imaging. What is that photosensitive material that is used? It is the silver halide. It is the silver halide. In case of a mammogram, anode that will be used will be the molybdenum. The anode that will be used will be the molybdenum. Okay. These are the MCQs that you have to know regarding X-ray. Other than X-ray, among the röntgenographies that you have to know is the thermography. Thermography uses infrared rays to reflect the arterial blood supply. Right? This is mainly used for breast tumors, placental localization, carotid insufficiency. In all these scenarios, they use this thermography. Then there is something called zero radiography. Zero radiography. What is that? Zero radiography is an image. It is used for imaging the breast, and the image receptor here would be the selenium. The image receptor here would be the selenium, and this zero radiography has got a high radiation exposure. It has got a high radiation exposure. Then coming to CT scan. In CT, of course, it was discovered by Godwin Holmesville, and hence you got the Holmesville units. You have non-contrast CT, which you use for head injury and acute management. Whereas high resolution CT scan, the HR CT scan, it is mainly used for diagnosing the lung parenchymal issues. Maybe an interstitial lung disease or bronchiectasis or COVID. All lung parenchymal issues, you usually use this HRCT. Then spiral CT. This uses a principle of volumetric acquisition. Where you have the center table in which the patient is lying, and the film around will rotate around. The machine will rotate around the patient, thereby shooting each and every direction. You will get a better CT image. This is what is regarding CT. Then MRI. MRI, it is basically based on the principle is the gyromagnetic property. The principle is the gyromagnetic property of the protons. That is the hydrogen ion. The contrast, which is most commonly used in MRI, would be the gadolinium. Gadolinium BDPA will be the contrast which is most commonly used. And of course, we already know that there are two times, relaxation time, so-called relaxation time. T1 and T2. T1, it just denotes the time taken to return to the original axis. These images are used to find out the normal anatomic details. And it's got a high soft tissue discrimination capacity. Whereas T2, it is time taken by the protons to displace. It is used to assess the pathological conditions. Right? Whenever you see an MRI image, you have to see whether it is a T2 weighted image or a T1 weighted image. How will you see? Water will be white in T2. Okay, water will be white in T2. So, in a T2 weighted image, you have to look into the CSF area. If the CSF is white in color, it is a T2 weighted image. If the CSF is black in color, it is a T1 weighted image. This is how you differentiate between the T1 and T2 weighted images. Right? Then the other modes of scanning includes the PET scan, positron emission tomography. Usually, it generates a transformed image, transverse image that depicts the distribution of positrons inside the body. The PET scanner usually uses the anti-lesion coincidence detector instead of collimation, which is used for CT scans. This helps in finding out the active components of the cells. And what will be the radiological component, the contrast component, or the one which is used, that is the 18-fluorodeoxyglucose. This will be given in the IV line, and this will be taken up by the cells very fast, especially the cancer cells, neoplastic cells. They take up this glucose. So when you scan it, that glucose will send out this fluoro component is there, right? So it will emit the radiation that is picked by the PET to detect the cancer cells inside the body. Okay. And also you can give radionuclide oxygen, which will give an idea about the oxygen uptake by the cell. Then gamma cameras. Gamma cameras are usually used in the nuclear medicine department to measure the radioactivity, right, by using a detector. For example, for a papillary carcinoma of thyroid, you give an iodine 131 scan. In this scan, as soon as the patient drinks of iodine 131, it will go inside the body GA tract, and then it has to be absorbed by fluid circulation. And the thyroid tissues, it will try to absorb this iodine 131. So it will take some 1 to 2 days. Say after 24 hours, you again come and do this thyroid scan. I mean, in the thyroid area, you put inside, using a detector to find out the radioactivity. Using this gamma camera, you try to find the radioactivity in the neck region. If the radioactivity is present, then the thyroid tissue is remnant. If the radioactivity is not present, then thyroid tissue is not there in the neck region. This is an example of how gamma camera is used. Then what else? Ultrasound. What is the principle behind ultrasound? What is the principle of ultrasound? Come on, principle of ultrasound. Piezoelectric effect, right? The crystals in the ultrasound machine, it generates a particular frequency that hits the organs, and then return back it is accepted, it is sensed by the ultrasound probe, the footprints which will sense it, and thereby it is converted into an image. So that is the basics. Then you have this A mode. A mode in ultrasound is an amplitude mode which is used for biopsy in the eyes as well as the intraocular lens power calculation. It is actually an ophthalm mode. It is most commonly used in ophthalm. D mode is the one which we use most commonly in our images. M mode is the motion mode where you use in echocardiography. We also use in reduction of the pneumothorax also use this M mode. Then another modified form of this ultrasound will be the Doppler. The main principle of this Doppler is recording the shift of moving object. Recording the shift of the moving object. Usually, when a blood flows away from the probe, it will blue in color. Blood flowing towards the probe, it will be red in color. Right? So this is what is regarding the Doppler that you have to know. That's all. I think that's all regarding the main theory part. We'll go into the theory. I mean, they made this part. Okay, tell me what all this is the normal chest X-ray. What is this one? This is a CT scan and this is an MRI. Okay. This is how a X-ray, MRI and a CT will look like. What is the diagnosis of this picture? Come on. If you know, answer. Otherwise, say I don't know, so that we can proceed fast. Okay, I'll give you a hint. A 23-year-old male, 23-year-old male, coming to the hospital with a saturation of around 80%. As the time passed by, he is suddenly collapsing and going for a hypotension. With hypotension, bradycardia, and further drop in saturation to 60. What will be the problem here? Yes or no? You want to guess or no? Am I audible?
Yes, ma'am.
Okay. See, if you look here, the lung parenchyma is present in all these areas. Okay. But the lung parenchyma is not, see, it is a black color. Black color means air. Okay. Air has pushed the parenchyma to the other side. So whenever there is an air in the thorax, what do you call it as? We call it as the thorax, right? It is a tension pneumothorax because the person is presenting with a decreased saturation and thereby leading to a further cardiac compromise. So this is a tension pneumothorax. What will be the first treatment of tension pneumothorax? You put the needle thoracotomy followed by an intercostal drainage. So in intercostal drainage, you put a tube inside, which is of 18 to 22 French size, whichever size is suitable, you put it inside and connect it to a water column. So the air, whenever the person breathes, the air will come out from this area and the lung parenchyma, which is hidden inside this area, will expand. Okay. So whenever such is the mass of pneumothorax, you give you put the patient on an ICD, and non-invasive ventilation will help. The positive pressure will help in expanding the parenchyma and letting out the air inside the thoracic cavity to come out through the intercostal tube. Okay, this is tension pneumothorax. Then what is this one? First was X-ray or CT or MRI? What is this? First, X-ray, CT or MRI?
CT, ma'am.
Exactly. This is a CT image. Agree. What is the finding here? You see the heart, you see the vertebrae, you see the ribs, right? And this is the lung parenchyma. This is the lung parenchyma. This area is all the lung parenchyma. And if you see, lung parenchyma is pushed to one side and a dark space is occupying. What is this? Something is occupied in this area. What is that?
Coarctation of aorta.
Here you saw this air occupying the thorax, right? In this area we saw the air occupying the thorax in the pneumothorax, right? Imagine the same picture in the CT. Same air is occupying this area. Same air is occupying the area and pushing the lung parenchyma to one other side. It is a pneumothorax. Okay. Same X-ray. I am showing it in a CT form. The same X-ray. If the same person, if I do an ultrasound, in an M mode ultrasound, you focus on the lung sliding part. In the lung sliding part, you put the patient on an M mode. There will be no motion of the chest wall waves and positive lung motion will be seen. This will be the seashore sign. If you look at it, it will be a seashore. In a pneumothorax, there will be chest wall will not be moving, lung will also be not moving. So it will look like a barcode. This is a barcode sign. Can you see? It will be just like a full barcode. So barcode sign will be seen in case of a pneumothorax, and this seashore sign will be seen in case of a normal lung. Right? What nowadays, in order to rule out all these things, they have introduced something called FAST. FAST is a focused assessment of with sonography for trauma. Any person coming with trauma, you have to assess the person. You have to first say this is the sternum, chest, abdomen, iliac fossa. First, you have to scan the right hepatorenal pouch, left hepatorenal pouch, then the suprapubic region, and after that, this was the basic things that were there, and now they have included as E-FAST, where you examine the lung sliding also. You put the probe over here in the lateral region and you find out the lung sliding also in an E-FAST. So FAST is the one which helps in the finding out the fluid collection. If there is any trauma inside the body, and from fluid collects means you can see the collection in the hepatorenal pouch or lienorenal pouch or above in the suprapubic region. If there is a pneumothorax, you can see if the lung sliding will not be present. So in that case, you can find out the pneumothorax. Right? Next, what is this? I have given one disease where you have all this picture. X-ray and CT picture. What is the disease? You want a clinical history, a young man, 30-year-old man who is a dancer by profession, and he likes veterinary dogs. So he has a lot of dogs. The person presents with fever and tachypnea. What will be the diagnosis? First, see, I gave you a hint of dog. Dog means what could be the possible organism that is involved? It could be a dog tapeworm. What is a dog tapeworm? This Echinococcus granulosus. Echinococcus granulosus. Okay. If it's an Echinococcus granulosus, then what will be the disease that is because of this Echinococcus granulosus? Come on. What will be the disease that is caused by Echinococcus granulosus? It is hydatid cyst. Right? Hydatid cyst will be echinococcus. In hydatitis, you have the active worms inside. The active hydatitis will be there inside. This will give the water lily appearance. Okay, this will give the water lily appearance. So whenever you see a water lily appearance, it is the hydatitis cyst which is causing this water lily appearance. Then this patient, example, a 54-year-old male presenting to us with hemoptysis. What will be your diagnosis? They've given the arrow mark also. You just have to find out the name of the, and you have to just identify the problem. Doesn't it look like a popcorn? Popcorn calcification. Where is it seen? It is seen in case of a pulmonary hamartoma. Right? Popcorn calcification is seen in case of the pulmonary hamartoma. Next. What is this one? It is the Westermarck sign. This sign is the Westermarck sign where you have this picture identified, and it is seen in pulmonary thromboembolism. Give me a classical example where you see a pulmonary thromboembolism. A 70-year-old female who is 120 kgs, posted for PKR, total knee replacement. After surgery, she was bedridden for a long time. Suddenly, she developed a tachycardia. And you see the X-ray, it is like this. What is the diagnosis? The patient has got a deep vein thrombosis that hence dislodged into a pulmonary thromboembolism. And this will be the Westermarck sign that you see in the pulmonary thromboembolism. Then, if you take a CT of that patient, the embolism will go get stuck like this in the pulmonary vessels. This is called as the saddle thrombus. This is called as the saddle thrombus that you see it in a CT angiogram picture. Right? Then, if there is an acute pulmonary embolism but partial occlusion, then it will be give this polo sign or a Cramming sign. If it is a partial embolism, you will this is the same picture. If there is a partial embolism, the outside part might be empty and inside around it might be occupied by the thrombus. So this is what is regarding the thromboembolism. Then these are the other possible signs that can be seen in a pulmonary thromboembolism. Fleischner's sign, Hampton's knuckle sign, look at this knuckle sign, Hallas sign and Chang sign. You might not be able to easily identify all the signs, and hence at least just remember the signs alone. Okay. Then coming to this picture, is basically a picture of atelectasis. This is an atelectasis. There you have this common tail appearance that will be seen in the atelectasis. It is a very much typical of atelectasis picture. Then, what is the problem here? You see the shape here. The upper lobe has collapsed here. So it is the golden S sign that is seen in the right upper lobar collapse. It is the golden S sign that is seen in the right upper lobar collapse. Tell me this one. Diagnosis. The patient with the RTA has a chest pain and has come to us. In this, this will be the X-ray and CT. What will be your diagnosis? What will be your diagnosis? Come on, there is an arrow also here. Can you see? There is an air in that area, right? There is an air in that area. If you notice here, surrounding this area also there is air. What is that area? That is the pericardium. Air in the pericardium, what do you call it as? Air in the pericardium, what do you call it as? Pneumopericardium. Right? It's the pneumopericardium. Next, what is this sign? A child presenting, or a child or a 10-year-old boy presenting with an lower respiratory tract infection along with a sore throat. What it is? It is an epiglottitis. Epiglottitis is okay. You have this thumb printing sign. It looks like someone has kept the thumb here, right? So it is a thumb printing sign. Where else do you see thumb printing sign? Where else do you see thumb printing sign? Come on, where else do you see thumb printing sign? It is seen in ischemic colitis. This thumb printing sign is seen in ischemic colitis. Can you see here? This looks like someone has kept the thumb print here. So it is seen in ischemic colitis. Then this is the, can you see the steeple like this one? This is the steeple sign that is seen in case of croup. Right? This is a steeple sign that is seen in case of croup. Then this is the bat wing sign. Right? This is the bat wing sign that is seen in case of what?
Mitral stenosis.
Where do you see? Sorry?
Mitral stenosis.
Where do you see bat wing? Bat wing is always seen in case of a pulmonary condition. Whenever there is a pulmonary condition, you have this parenchyma that is fluid, is filled with parenchyma that is filled with fluid. Thereby, you have this bat wing. Where do you see pulmonary condition? In pulmonary edema. In mitral stenosis, the patient may or may not have a pulmonary edema. Mitral stenosis is a disease. Okay, whereas pulmonary edema is a presentation. So I'm saying this fluid overload inside the body due to any cause like cardiac cause or renal cause or whatever may be the cause, it will be a pulmonary edema showing the bat wing appearance. If a person comes to you with pulmonary edema, how will you treat that person? First, you have to restrict the fluids. Second, you have to give diuretics for this patient to bring out the fluid. Third, you can put the patient on an NIV support. And also, you give some cardiac remodeling drugs for the cardiac pumping to be better than the previous one. This is our pulmonary edema. It was an earlier factor where you diagnose the pulmonary edema using an X-ray. Nowadays, we use an ultrasound to find the pulmonary edema. In ultrasound, can you see in the lines like this, from top to bottom, line which comes from here, right? These are the B lines. When the B lines are more than 3 in number in one window, that means to say that there is a fluid collection in the lungs. Okay, so since nowadays everything is ultrasound based, it is easy, no problem at all. So all those things, it is not going to be harmful to the patient, and hence we use ultrasound now and then and there. Right? Okay. What is the diagnosis? Clinical situation: a 40-year-old female, not female, male. There's no breast in the X-ray, so 40-year-old male coming with a severe fever, breathing difficulty. What is the diagnosis? On. What is the diagnosis? Okay, I'll tell you a hint. He is coming in the month of or during the COVID era. I can say COVID era. What could be the possible diagnosis for this patient? The patient could have a COVID pneumonia, right? The patient could have a COVID pneumonia. You see the presentation, which is in the opacities occupying this area is all typical of a coil. So I took the CT scan. In CT scan, you have this typical peripheral. Peripheries are much more involved. You see, here, this is a very typical COVID pneumonia where you have the peripheral parenchyma involved more than the central parenchyma. So it is a typical COVID pneumonia. Then this patient who was in the ICU, a 50-year-old male who was in the ICU, in a severe sepsis. This patient, if lung involvement is too much, the entire parenchyma of lung is involved. Is basically a patient in septic shock. I can say sepsis. Shock I cannot comment unless I know the hypotension part. So if the hypotension is also present, then I will call it as a septic shock. What is this one? How? What is this picture? There is a CT image of which disease? This is a CT image of which disease? Come on. Say the ARDS. Acute respiratory distress syndrome. Okay, the entire lung parenchyma is involved. It is an ARDS, acute respiratory distress syndrome. Okay, this case, a 40-year-old male comes to us with a history of RTA. He has a breathing difficulty. If you see this X-ray, what will be your thinking? See, there is a blunting of this fluorophenic angle, right? The angle which was supposed to be here, it is blunted because there is some fluid that is collected in this area. The fluid can be either a pleural effusion or they've given a hint of RTA. So it could be a hemorrhage inside the lungs. Hemorrhage, blood would be collected in this area. And hence we took a CT and you see the blood whichever is collected has dropped down because of gravity. It is collected in the bottom part. So it is a pulmonary hemorrhage, the so-called hemothorax. It is the hemothorax. The treatment of choice is mild hemothorax. You can manage it without anything, just by conservatively. If it's moderate to severe, you put inside an intercostal drainage tube and let out the blood contents. Now you treat the hemothorax. What is this? Come on. Come on. A bowel which is supposed to be inside below the diaphragm, it has come inside the thoracic cavity. So that goes on to say that the diaphragm is not intact. So it is a diaphragmatic rupture. The diaphragmatic rupture. This one, see if you see, it is a finger in glove sign. Finger in glove sign is in zero as a allergic bronchopulmonary aspergillosis. It is seen in case of allergic bronchopulmonary aspergillosis. Then, what is the diagnosis of this X-ray? The lung has to be ideal stopped in this area, but has got extended. It is hyperinflated lung. Hyperinflated lung. It is seen in case of COPD patients, and these patients are highly prone for a spontaneous pneumothorax. These patients are highly prone for a spontaneous pneumothorax. This is the tree in the bud, right? So similarly, like tree in bud appearance, you see it in case of an endobronchial TB, endobronchial spread of TB. Endobronchial spread of TB, you have this tree in bud infiltrates. Then what is this one? Three sign. Where do you see it? This three sign. You see it in coaptation of aorta. You see it in the coaptation of aorta. Then is the root sign. Where do you see the root sign? You see it in the tetralogy of Fallot. Then snowman sign. You see it in total.
PAVC.
Exactly. Total anomalous pulmonary venous connection. That is where you see it. Then what is this sign? Only one bubble is there. It is a single bubble sign. Where do you see it? Single bubble sign is seen in pyloric stenosis. Right? Double bubble sign, where do you see? Where do you see double bubble sign? These are all named MCQs that you have to do. It is seen in duodenal atresia. It is seen in duodenal atresia. Triple bubble sign. Triple bubble sign is seen in ileal or a jejunal atresia. Right? Next, what is this? String of beads. Where do you see string of beads sign? Where do you see string of beads sign? You see it in small bowel obstruction. You see it in small bowel obstruction. Perfect. Then, what is this one? It is the diaphragm, and you have air here. Air under diaphragm. Where will you see air in the diaphragm? Whenever the air from the intestine goes out, you have this air inside the peritoneal cavity, right? Otherwise, you will not have. It is basically what? Intestinal perforation. It is a pneumoperitoneum. Air in the diaphragm is nothing but pneumoperitoneum. When do you see pneumoperitoneum? It is in case of some perforation inside the intestine. What is this rat tail sign in the esophagus? Seen in CA esophagus. Seen in CA esophagus. Then corkscrew. Corkscrew
Yes,
sign
ma'am.
of the esophagus. What is this?
Diffuse esophageal spasm.
Exactly. Diffuse esophageal spasm. What is this? Coffee bean appearance. Where do you see this coffee bean appearance? You see it in sigmoid volvulus. Right? You see it in sigmoid volvulus. Then, where do you see this apple core appearance? The apple core appearance is seen in case of CA colon. Then, this claw sign here, right? This is seen in case of intersusception. Then, what is the diagnosis here? You notice it is like this, right? What is the diagnosis? It is a flower vase appearance. Flower vase appearance is seen in what? Horseshoe kidneys. Flower vase appearance is seen in horseshoe kidneys. Then this one, what is the answer? What is the answer?
Uretrosilma.
Exactly. It's the cobra head appearance. The cobra head appearance where you see the uretrosil. Okay. What is the diagnosis? What does it look like? Looks like
Christmas
a
tree.
Christmas tree. There you see Christmas tree bladder. Christmas tree bladder, where do you see it? You see it in neurogenic bladder. You see it in neurogenic bladder. Then this one looks like the bladder in ultrasound looks like a keyhole. You see this. Can you see this? It is a condition where you have a posterior urethral valve. If you have a posterior urethral valve, the ultrasound feature will be like a keyhole sign. Then you see, it looks like the fingers in the brain. That is the Dawson fingers. Where do you see Dawson fingers? We discussed 2-3 days back. Dawson fingers in the brain. You see it in multiple sclerosis. Dawson fingers, you see it in multiple sclerosis. Then CT image, where you have this picture in a CT image, a trauma RTA patient. Forget about RTA. Some 60-year-old female with a spontaneous headache. With frequent headache followed by unconsciousness. What will be the diagnosis here? And you see the red pattern mark. It is all blood in that area. It is a subarachnoid hemorrhage. It is a subarachnoid hemorrhage. Subarachnoid hemorrhage, most common cause would be the rupture of the Berry's aneurysm. And that's why I told you that example. This is the, you see this area, if you see this area, it will be a melting, ice melting sign. Right? It will be an sugarizing sign. Sugarizing appearance in the medulla region. This will help us in the diagnosis of medulloblastoma. Then, what is this diagnosis? You have a skull like this. It's like a map, right? So it is a geographic skull. Geographic skull. It is seen in eosinophilic granuloma. Geographic skull is seen in eosinophilic granuloma, whereas punched out lesions in the skull, like punched out lesions like this, it will be seen in multiple sclerosis. Right? Where do you see this appearance? Hair on end appearance. Hair on end appearance will be seen in thalassemia. And the picture frame appearance.
Age is different.
See the spotfish appearance. Or fish vertebrae. This is a codfish vertebrae and this is a fish mouth vertebrae. Seen in case of sickle cell anemia. Then the salt and pepper skull. Usually this will be seen in case of vascularity in the globus tumors. You have this salt and pepper skull. The Scottish shock appearance of the vertebra will be seen in case of spondylosis. These are all named things that will be easy for you to remember. Then, what is this feature? Looking at a strawberry, right? It's a strawberry skull. Strawberry skull that is seen in case of trisomy 18. Okay. Then onion ring appearance of a bone. Example. Where do you see onion ring?
Wing sarcoma.
Exactly, as wing sarcoma. Right? Where in which you see the soap bubble appearance of the skull. Bone. Soap bubble appearance of the bone.
JNC.
Osteoclastoma. Okay, is an osteoclastoma. Then coming to a condition where you have this ochronosis. Ochronosis, black pigmentation will be there, pigmentation in the upper area, and you have this calcification of the intertubercular disc, intervertebral disc. This will be seen in a condition called alkaptonuria. What will be the urine color in alkaptonuria? What will be the urine color in alkaptonuria? Black color urine will be there. Okay. Initially, the urine which comes out of the body will be in the normal transparent color, but after getting exposed to the air, it will become black color. Radiology is fine. Where is it seen? Radiology is fine. It is usually seen in osteopetrosis. Then it is also seen in osteodystrophy. Osteodystrophy that is due to the chronic renal failure. In both these conditions, you can have this radiology finding. This is an ultrasound picture of a fetus where you have an anencephaly, and anencephaly means there will be a Mickey Mouse sign will be there in anencephaly. What is this sign? And who can do this? This is a Steinberg sign, and who can do this? Only a Marfan syndrome person can do this. Try doing it yourself. 100% your thumb will be inside the hands. The thumb will not go beyond. If it's going beyond, then you are possible of Marfan syndrome. Then an RTA patients, if you want to go for a X-ray and CT scan, if you see something like this, something in a crescent pattern, then it is an STH. If you see some idli in the corner of a skull, what is it?
Idiot.
Idli? Exactly. Idli, EDH. Sounding similar, right? So, idli, EDH. Remember like that.